The Smith & Nephew NAVIO Surgical System. The freedom of robotics in your hands for the Journey 2 XR Bicruciate Retaining Knee System. The NAVIO unit has a small footprint, ideal for any OR and portable for OR efficiency. First, anatomic landmarks are captured, including a 3D model of the patient's cartilage and bone through direct surface mapping for both the femur and tibia. Next, soft tissue kinematics are evaluated for implant positioning and soft tissue balancing. Furthermore, the surface mapping and soft tissue evaluation provides the surgeon patient-specific planning to virtually place implant components and predict postoperative joint laxity through the full range of motion. Once the planning stage is complete, NAVIO handheld robotics is used to accurately remove distal femur bone per the NAVIO plan. Next, set rotation and placement for the AP cut guide by robotically preparing the pinholes. For the tibia, utilize the NAVIO handpiece to prepare the bone for the Journey 2 XR base plate. During trialing, NAVIO allows surgeons to confirm postoperative joint laxity compared to the intraoperative surgeon plan, with the flexibility to perform and evaluate ligament releases. The NAVIO Surgical System, the only handheld technology for knee arthroplasty, where surgeons and robotics work hand in hand.